All right. Thank you for coming to the refresher training this evening. We're going to go over the purpose of intake, you know, what we do, why we do it, how we do it. Really, to cut to the chase, it's about getting the cats vetted and or recovered as quickly as possible so we can get them adopted as quickly as possible. And in that, you know, system we have of working in here on the medical side, it really is a buddy system so that you can go at your own pace, get trained at your own pace, do what you're comfortable with. And then if you want to learn more, we'll buddy you with somebody to learn more, and then that'll just help your growth as much as you want it to be. We'll talk about how shelter medicine is different from your regular home care medicine that you have with one cat versus 80 to 100 cats. And basically that is simply, there's a lot in one small space, so the chance of transmission to the next cat is very high. The ability for that is very high. So that's why we need to clean and sanitize properly everything. And if you think about that cage, everything in it has been cleaned and sanitized. The cage, the litter box, the dishes, the blankets, whether it's from the washing machine and dryer, the dishwasher, the heat, or our own cleaning with soap and water, and then sanitizing with the rescue. That rescue is a veterinary grade solution at a concentration of 1 to 16, kills the viruses, it kills the bacteria, and it kills the fungus. So that's our Caleci, which is the worst one, the ringworm for the virus, and then all the bacteria that's there. So that's designed to ensure that we don't have cross-contamination happening within the facility. So it's, and then our hands, and this is where we always hear us saying how important it is to wash or sanitize your hand between touching each and every cat, because that is another way to transmit whatever that cat has to that cat and to that cat, and we do not want to do that. So the cleaning and sanitizing, we cannot emphasize how important that is. And then the other piece that is crucial is the documentation on the cage cards. So the daily observations to show us what's happening with that cat. How are they progressing? Are they declining? Are they improving? Is the treatment plan working? Is it not? Do we need to adjust? So that's key. And they're designed to put the observation on the one column and then the action taken in the next column. So for example, dehydrated, we gave it fluids. Eye swollen and gunky, started terramycin. Diarrhea, started Panacur, you know, and on it goes. They're designed to show, you know, and track what's happening. So that, in a nutshell, is the key things about what we do. Alrighty, so for part 2, we're going to talk about the 2 separate things that we do here. One is if the cat is healthy, they're going to get vetted. The second part is if they're not healthy and we need to get them recovered and get them off to being healthy. So just to focus on the vetting part, there's a number of things that we do. So the first, when the cat comes in, we have to give it its vaccine. So that's the FVRCP vaccine, the most crucial to, again, help, like I said before, give them the best defense they have about you know, not contracting any virus that they definitely are going to come into contact here just because of the nature of our environment. They need a rabies vaccine. That is done by a veterinarian. So all the cats in here have to go out to see a vet in order to get that vaccine. The first one they get is valid for 1 year, and the second one is generally 1 or 3. And then the state of Ohio mandates that is done. And again, it has to be done by a vet. We can't do it here, unlike the FVRCP vaccine that we can do. The other vaccine that we do here is the Bordetella, and that one is a nasal vaccine versus the other one that is a sub-Q under the skin. And we do that again upon when they come in. Again, if they're healthy. If they're congested, we're not going to do that. You microchip them. That is the sub-Q, goes just in under the skin. The needle puts that microchip in there so they're traceable. If they get lost, they can, you know, hopefully find their way back home. Spay and neuter, obviously, population control. We got to check those ears, another thing we do, so make sure they're clean. Cleaning solution, there's procedures for how to do that. deworming them. That's our panicure that we do every 3 days. So that, the design by that every 3 days, every 24 hours. So not night and then morning, and then the following night, night, or morning. The way the worm life cycle is, you want to catch it every 3 days, and then that'll get it gone. And then there is the D-Flea, the Revolution or Advantage or the Frontline. It's topical, just on the back of the neck, so they can't lick it off. And then that's generally done every month. So as they're in here, hopefully they're not in here for a month, but if they are, we should be noticing that on their medical record and reapplying that. And the other thing we do is test them for the FELV and FIV, and that's a blood draw, and then there's a test kit you use and do that. So that's, and if all that goes well, they can be in and out of here in a week, and that's what we strive for. You know, get them in, get them scheduled for their spay and neuter within those 3 days, give them their panicure. They should get that vaccine as soon as they come in, and then when they're at their spay and neuter, they'll get their test, they'll get their rabies and their spay and neuter, come back, make sure they're all healed up, and then they can go to the adoption center. That is best case. Questions?
When do you give the Capstar versus the Revolution? Is that an age thing?
Good question. Capstar is for the live fleas.
Okay.
So you see a flea crawling on that kitten or they're
That's the
infested,
Capstar.
Capstar.
Okay.
Yep. And
Capstar is a topical too?
it's a pill.
Oh.
It's a pill. And so with that too, good segue into if they're sick. So part 2 is if we have to recover them, and this is where there's a lot of information here, because this is where the real work comes in, but I would say where the stress of the environment comes in. So we're dealing with the sick guys, we're trying to make them better, and usually they get better, but sometimes they don't, and that's a reality that we have to accept. And you just know that you did the best you could with what you had, and you know, as long as we're communicating and we're documenting things and sharing our concerns, that is, you know, the best thing we can do for the cat. So the first one I'll talk about, easy, is weight. And I put that one at the top of the list because from the weight defines the dosage of what we give them. So that's important. We have to weigh the cat. And that's easy enough to do, depending on the temperament of the cat, of course. But again, clean, like sanitize the balance, the scale before we use it. Kitty goes on, gets the weight, and then we know if we have to give it meds, what dose we would need to give it. So that one's pretty straightforward. It also helps us monitor too. If we've got a kitty in here that's not eating, and we know he came in at 8 pounds, and now he's 6, okay, that's a big deal, you know, and you know, we need to figure out what's going on, get that kitty to a vet, or you know, maybe it's syringe feeding or something. The next one I would say that is the most important is after they've been to a vet and prescribed an antibiotic, that we give that to them at the right time, at the right dose. So the timing is important. If it's twice a day, that implies every 12 hours. Now, it's volunteer setting. We can't, you know, it's just the nature of what we do here. We just do the best we can. So at minimum 8, obviously desire 12, minimum 8, 10 okay too, you know, so we do that for them. Some of them are oral. Actually, most of them are oral that we have, right? It's the Clavamox, the doxycycline, the Vamciclovir, and I'm probably maybe saying some of these wrong. The pills I wanted to add, yep, the Alabon, the worm one. The pills, also important, is to chase them with water. Just like us, if you try and swallow a pill and it can stick. And if it sticks, it can burn their esophagus. So lots of water, or don't waterboard them, you know, like just make sure they've rinsed that down. And I'll give them some nice food that they can't resist, just to make sure they're really trying to push that down. Because, you know, if you think if they're on pills for a week or 2, you know, every day, and that happens every day, so that's an important part of the oral antibiotics too. And then if they're pain medications, of course, that's another one that is going to be really important that the time is there. So you'll see them come back from their spay and neuter, and they'll maybe be given Medicam for 3 days or 5 days in a row. Again, they come back at night, they're still under the drugs from having their spay and neuter that day. So it's the next night we want to start. And then it's the next night for the second, and the next night for the third. We don't want that to be night, morning, and then the next night. Like that's, you know, that he's going to be too much and then not enough. And if you've ever experienced pain from a surgery or a break or whatever, you know that staying on top of the pain is the way to go. You don't want that pain to get to the point where you need that med and then you have to wait for it to catch up. That's not nice. So the timing is important. The dosage is obviously important. And the other thing that is important is the instructions. If it says shake well, you need to shake well. That on the bottom, sometimes you can see the sediment. On the Doxy is one that settles out. Clavamox can settle too. Panacur is another one that really settles out and is really cakey in the bottom. So if you don't shake it and resuspend that, like look at the bottom and make sure you've got it back in solution, you're either giving not enough or too much. Like if you get to the bottom and it's concentrated, you're giving that kitty way too much, and vice versa, not enough. So the shaking is so important. Refrigerating, also keep Clavamox, pardon me, in the fridge. Teresiderm in the fridge, and can be other things. It depends on how that vet office wants it made. Doxycycline is one that is sometimes in the fridge and sometimes it's not. So you just got to read those labels and make sure you know if it's got to go in. I also recommend that, you know, because of the nature of what we do with so many cats, not to take it out of the fridge and let it sit there until you've done your whole shift. Take it out, know who you need to do, aliquot it out, go do those, and but put it back in the fridge. So just like you would at home, you wouldn't let it sit out. You would take it out for your one cat, take up what you need, and put it back in the fridge and go and administer it to your cat. So same kind of idea here, just to keep it in the fridge for as long as possible, not letting it sit out, and it's easy to forget. I've done it, you know, you get busy doing something. So I try to do that anyway. That's my new practice, to make sure I'm keeping it in the fridge. And the other one is to protect from light. The albuterol, if anything that comes in a dark brown bottle or a foil packet, you need to protect it from light. So at all times, that doesn't change, you know, so the albuterol is in the drawer under the cupboard and it's protected from light. And then the brown bottles, obviously, they're protected from light by the nature of their storage. So those were the key things that I wanted to remind on the oral medications and like the antibiotics and the pain meds. Okay, good on that one? Okay. Okay, the next one is topical treatments, which is the wound care in the eyes, incisions and wounds. So this is, again, just like you would do for yourself, you know, the Vetericin topical, you just spray it on. The Terramycin in the eye. Let me see, what else did I have here? The ears, the cleaning of the ears. So the solution, just put it in there, rub that ear around, let it work its way down in there. Try and hold the cat's head still, do both ears, and then you can let him shake his head, and stuff can come out. So, but anyway, that's how you clean the ears, and then you can use a cotton ball to just take out the excess and try and get as much just from where you can see. What we do not want to do is risk pushing any of that debris down further into their ear canal with a Q-tip, and we would do more harm than good. So that's the key about the ears, is just let the solution do the work. Cat'll shake it out, and then you just dry out what you can with the Q-tip. We don't want to be pushing anything down in there. The eyes, we've got the Terra, which is the gel, and then sometimes the vets, if that's not working, the Terra is really good for bacteria. The viruses are the things that really make the conjunctivitis there, the swelling and the, without the oozy goozy greeny goopies. Generally the drops tend to work better for that, but they're prescription. So as soon as we get that prescription, we do those. Wounds can be tricky. They're not for everybody because it's just so visual. It's just there, and sometimes they can be really bad. So this is the one area where I really understand if people say, yeah, no, not going near that when it's just too much. But generally it's just the same as us. Keep it clean, keep it dry, keep the antibiotics on it. Again, that could be oral as well, you know, or topical, but it's really about the wounds, and the Vetericin is the best thing we have for that. And it's a nice spray, so you don't necessarily have to touch. Yeah, and then incisions too, same, like stitches, just like you would for us. You just keep them clean. Sometimes you need to soak them like with a warm compress or something, but generally the instructions are there, and the topical stuff is pretty straightforward.
Does the Vetericin go directly on the wound, or does it go more on like a cotton ball and then onto the?
Either. I would
Either.
say it probably depends. Some of the Vetericin comes in a nice spray, as long as it's not a too hard of a spray
stream.
that's one gonna spray or hurt as it hit. Then
long
I
as
would
it's
want
mist.
a cotton ball. Yeah, a nice
Mist.
mist is good. And then, or a cotton ball, but if you use a cotton ball, you wanna make sure it's clean out of that bag, not one that's been laying around, right? That's okay. The other thing we do, the nebulizing. We hear that thing going, and everybody's like, what is that noisy thing? That nebulizer really helps the cat with congestion. So when they're really congested, you know, we're gonna clean off that nose, just warm water, let it soak on there to soften that, and clean that off. So when they go in the nebulizer, which is also cleaned and sanitized, as well as the blanket that's in there, the hose, everything about it gets cleaned and sanitized. Periodic, like, you know, there's a sequence, a timetable for those things to get done. But between cats, you spray it out with the rescue and change the blanket out, because if there was one in there with Khaleesi, we don't want that to go to the next one. And in the chamber on the front of it, there's like a little cup thing. You would put a ml of saline, half a ml of the albuterol. You clamp it shut, the cat in there, close it, and then you put the towel on the front. You see it clamped on there. Turn the pump on, turn your timer on for 15 minutes. And that pump is gonna nebulize, make a very fine mist, which goes into the cage, and they breathe that in. And that albuterol just helps open up their airways. It's just like a vasodilator, just helps them breathe and clean them out a little bit. And then the timer goes off, and you turn it off, and you take them back, and it's really that simple. But again, the key is that albuterol is a medicine, so you only put the required amount in there, and we would do the cats only 3 times, and only if they're really bad you'd consider doing it more. So again, it's about the dosage of what you're doing and the frequency of what you do. So it's important to note when you do it, so it's not every cat that is congested. If it's slightly congested and sneezing but is breathing okay, that's fine. It's the ones that are really congested that we want to target and do, because it again is a medicine. Unlike if you used it just for the steam itself, just the saline, like a hot shower for us at home, then yeah, we can do that lots, you know, and that's not going to hurt them either. It's just if you're using the albuterol, the guideline is 3 times. And then only if they're still really bad, we would consider doing it more than that. Temperature is another one that's indicative of obviously if they're fighting something or not. So just like what you see at the vet, just it's a rectal thermometer, put the Vaseline on it as a lubricant. I really like the ones that have the flexible end, so you don't have to stress so much about holding the cat still, because it's obviously uncomfortable and foreign and they don't like that. But it's pretty straightforward. But again, the cleaning and sanitizing of the, you know, take the 70% rubbing alcohol and clean the thermometer before and after you use it. And that's pretty straightforward. And if you have a fever, you definitely want to note that and let somebody know that you've got a cat with a fever. There's clearly something going on with that cat. For vaccinations, we have 3. The FVRCP is the one that we do as soon as the cat comes in the door, right? It's the one that protects them most against the viruses that they're going to come into contact here. It is the one that is the blue vial So there is a liquid and a powder. So what we want to do is with a syringe, you pull up the liquid out of this one and you put it into this one, into the blue one, into the powder. You give it a mix and then it's ready. And you have to do this within 15 minutes. Otherwise, it just becomes ineffective. So then there's no point in doing it. So you've only got 15 minutes, literally once it's out of the fridge, not once it's reconstituted, because it's a temperature thing. So again, it's refrigerated. And then you inject it into the cat, generally into the left forearm, just under the skin. It doesn't have to be intramuscular, just under the skin. I usually just pull the skin up a little bit, put the needle in, and put it in. You don't want air, so just the solution, just the vaccine, and that's it. And then if the cat is small, a kitten, or just too small for that, you can just do it in the scruff of their neck. Just pinch up their scruff and put it in there. And the scruff of the neck is nice for the kittens because just as the way nature works, that's where mama cat would pick that cat up and carry it. So they don't have as many nerve endings in the scruff of their neck. So it's just, they just don't feel things as much there. The next vaccine is the Bordetella. This is the one that is in the brown and the yellow. So same concept, you get the liquid out of here and you put it into the powder and you mix it up. The difference with this one is that it goes in the cat's nose. And just a couple drops in the nasal, and this is for the Bordetella.
Just with a syringe with no needle, is that what you...
Yep, you just draw it up. These lids are hard to get off, but other than that, that's the hardest part of this one. It's actually not the hardest part. To be honest, the one that is injected is easier to do than trying to get this in the nose of a cat. Although it's not easier to do from our standpoint in terms of nerves and knowing you're actually, it's more of an invasive thing to go into the skin of a cat rather than just put a drop of this in their nose, but it's trickier. And I'll just, again, the last one is the rabies, but the vet has to do that for us, kind of unfortunately, because it's the same. It's just a needle under the skin. The technique of it is nothing special. It's just that by law, it's required in the state of Ohio that a vet has to do it. So that is the high-level review of the vaccines. Hydration. The kitties you'll see often on their cage carts under observation is dehydrated. They could have diarrhea. They could be vomiting and they're getting dehydrated. They have a fever and they're getting dehydrated. If you do what is called a temp test, which is just a pinch of the scruff of their skin, if that skin doesn't snap back, they're dehydrated. So the longer that kind of stays up and in that tent formation, the more dehydrated they are. The treatment for that is the sub-Q fluids, subcutaneous fluids. That's the IV bags that you see. So they're either Lactator's Ringer's solution or a 0.9% sodium chloride, a saline solution. And key to those is making sure they are always kept in a sterile condition. So the needle on the bottom, which is typically an 18 gauge for the adult cats, it just helps it flow in faster. Make sure that is clean and fresh and new for every single cat. If you are the one who is going to be using that solution next, what I do is as soon as I'm done, I change my needle so it's never stored with a dirty needle. Or if you're done using it for the day, the shift you're on, put the little green cap on it so that it's not hanging there without being covered and it's protected from the air and anything that could get on it. So that's important about the care of the bag and the line itself. To do the sub-Qs, it's pretty straightforward. You want to note where you're starting the line on the bag, so it's where it's at, because you want to be able to know how much you've put into the cat. For kittens, depending on the size of the kittens, okay, if they're teeny tiny, like 30, you get a little older, like 50, so like a 4-pounder kind of cat. We'll have these guidelines, An adult cat, you can do 100 to 150, and so then that's why you just watch the markings on the bag. So how you do it then, it's sub-Q, just in the scruff of the neck. You pick up that skin like a little tent, the tent test, and you put that needle in bevel up on a slight angle down and right into the skin where the people would go in the tent. And then, and of course you've already looked to see there's no air in the line. We don't want to be putting, a little bit of air is okay, a little bubble, no problem. It's not like you see in the movies where, oh, they're gonna die. No. A little bubble isn't gonna hurt the cat. You don't want a whole line full of air. I mean, a little bubble, like, you know, that's okay, nothing to panic about. Open the lock on it and it will flow in. Gravity will flow it in. You can make it go faster by squeezing the bag, because the faster you do it, the less time it takes, obviously, and then the less the cat is going to sit there and feel awkward about it. However, if you squeeze too much, it goes in really fast, and then that freaks the cat out a little bit. So you just got to judge the cat and how that is going. But it's really, not to minimize it, it's simple in terms of how to, but it is invasive to the cat. You're going in under their skin, so you have to be very conscious again of the air, of it being sterile, and making sure, like, again, you're setting in how you're doing it, that the cat's not going to be disturbed by something around and get startled and bolt away. You know, you just want to be in it. Watch your setting, I guess, you know, in their cage, out of their cage, whatever is going to work. If you need somebody to help you because the cat is a little more feral, or the young ones don't tend to tolerate that as much. So it's one of those things you kind of have to, it took me about a month to get really used to doing it on my own. It's, you know, and everybody's different about it. Some people can just start doing it. Like, I YouTubed it and talked to my vet, and I talked to people here, and I had someone show me, and before I actually really attempted to do it myself. So it's, that's what that is. Any questions about the sub-Qs? If you do them, write on their chart how much you gave. That's important. You know, if they're still dehydrated the next day, we need to know how much we gave them the prior day. We got to know that. We can't just say we gave them fluids. So the details of how much we gave are important. The testing for the FELV and FIP, it's a blood draw. So it's a two-person job. Someone to hold the cat, and there's a technique for holding the cat, and then the other person to draw the blood and do the test. So for holding of the cat, you lay them down on a towel, on a clean surface, and you scruff their neck, and then you hold their tail in and their upper foot up while your hand is pressing down on the inside of their bottom leg. So like the doctor on us has the tourniquet to help that vein pop up to get the needle in there. That's what we're doing with this meaty part of our hand on the meaty part, you know, of the leg to help that vein pop up. And then the person taking the blood holds that foot. This is tricky, it's tricky. And then they will go into the vein and draw out the amount of blood they need. And it isn't very much. It's such a tiny amount. It's much harder to get the blood out than it is to actually do the test. And then the test is a simple test, and you have to read the instructions to do it. I'm not going to cover it here, but you just drop it on, you drop the reagent on, and you wait 15 minutes, and it'll tell you if it's positive or negative for either or both of those things. The tricky part is holding the cat and getting the blood out. At the vet offices, they do it different. What I've seen at my vet is they'll take the blood from it's either the artery or the vein in the neck. We tie the leg. The leg is what we do here. So that's the test. Questions on the test?
Do most often, because I know when we send them to spay and neuter, we test a lot then, so I don't think we test too many here, do we, or do?
We test a fair more than I like, because I don't like doing it.
Okay.
But yeah, I wouldn't want to say 50-50, but I bet you 70-30. Yeah, we test them a lot here. Okay, so for the microchipping, we have this little apparatus. The microchip is sterilized and in a bag, and you would take it out and you attach it to the end of this, and then when you are going to inject the microchip, this comes out and it pushes the microchip out of the needle that it's in, and that's how it gets inserted into the cat. And it's that simple. And the needle goes in the back of the neck, between the shoulder blades, just under the skin. It's not into their muscle. It's just under the skin. And it's simple. except it's a big gauge needle. And that makes it intimidating. But otherwise, it is simple to do if you have the nerve.
Do the cats react strongly?
Sometimes, like they're gonna meow sometimes because it's smarts. You know, it's not comfortable.
Mm-hmm.
It's harder to do on the big toms. Their skin, by design of nature, is tougher to get in. So if you're not prepared for that skin to be tough, it's harder on the cat because, you know, you're pushing and pushing and pushing rather than just being a nice, clear, smooth entry and putting it in and pulling it out. Yeah. My first cat I did had really tough skin. It didn't work. But the next one was okay. So yeah, that's the microchipping. Okay, a little bit on documentation. When a cat comes in, they're surrendered, they get this form. This is just by design to get the high level stuff accomplished on the cat that needs to be done when they come in, and we can use it as a checklist. So it includes their name, first of all, so we name them. The microchip, we have to scan them for that to see if they have it. It's this, so turn it on, and then you scan. And when you're scanning the cat, you scan all over the cat because those little chips, they can move around. And sometimes you have to try different scanners because they're different chips from different manufacturers, so it's easy to miss one. But if they don't have a microchip, you just don't write anything down, just that you checked and there isn't one. If they do, then we have an opportunity to trace the owner of that cat. I've only seen that one time in my time here. Sex, breed, color, male, female. If you can tell they're spay and neutered, put that down. Breed, long hair, short hair, and then what color in terms of how we can describe them to try and tell them apart from another cat. Date of birth, you can estimate it. 1 year, 2 year, 3 months, whatever you think. Weight, there's our weight, right? So if we can weigh them. Spay and neuter date if we happen to have that. If we know they need a diet, sometimes if they're surrendered and the previous owner knows they need a special diet, we can put that on there. We talk about the microchip, so you check for that. D-flea, that's the revolution. D-worm, that's their first Panacur dose. Bordetella, that vaccine in the nose. FVRCP, the vaccine under the skin. The booster for the vaccine, we have to do that every 2 weeks for the kittens, up to 20 weeks, and for the adults, just once. So twice, like the first time they come in and 14 days later. So we write on there the count 14 days out and right there the next when they're due, so that when you glance at the chart, when you're in here, you can go, okay, this one's due today, and go get it and do it. Any visual notes that you see on the cat, if anything that you think, he's drooling, he's got a spot, he's got a scar, he's got whatever, you know, ingrown nail, like whatever, if there's any injuries that he's got that need to be addressed, and then your initials and date. And then again, it's the observations and then what we are going to treat them with to track it. The next form we have is their medical record. This stays with us and with the cat. So when they get adopted, this goes with their adoption papers. So it's separate because we want it neater. It's official. This is our working internal copy. So that's why there's two. It appears that we're duplicating work, but it's by design to make sure this is clean, clear, and concise for the adopter as well as the veterinarian who's going to be seeing it. And it has basically all of the same information on it. It includes the test results, if they're positive or negative for the FELV or FIV, and the Panacur, the vaccines, and their booster date, their Bordetella, and their rabies, and their spay and neuter date, and their flea prevention. Like everything that we covered is on here. So those are the two bits of documentation that we have.
And so these get completed when a cat is first put into a cage?
Yep, as soon as they come in, we start both of these, and they stay on the cage, and then they get into when they go to the adoption center, they go in the rescue groups file that we have. Also, as you made me think of something there, wanted to talk about the documentation that we have for when the vet prescribes a medication. So they come in all colors. Don't go by the color, because We don't have enough colors for every medication there is. Read the cage card, read what it is, read the dosage, when it's required, and then this helps us document and track what's been done, when it was done, and who did it. This should be self-explanatory. So when the cat comes back from its vet visit, whomever the medical person is on that shift needs to take those records from the transporter. And sometimes the transporter can do it, but sometimes they can't. So general rule, I would say, if they can't do it, make sure you do it for them, because some of them can, but not all of them. Is just transcribe that vet prescription to these sheets and get those medications started if applicable for that night. So for example, the spay and neuters come back. Sometimes they have meds that will start the next night. So that would be something we would get on their charts so that the next day they know to do that. Or if they came back from, like today I took a couple for upper respiratory and they came back with Clavamox that needs to get started. So the tonight shift can start their first dose of Clavamox. But we would need to get the sheet started for them. So yeah, that's just the other piece of documentation that we have on their cage cards. And sometimes there's more than one sheet, more than one medication, so be conscious of the number of pages and be conscious of the number of days that we have to do it. Is it 7 days? Is it 10 days? Is it 14 days? Because then we're going to stop, because that's what the vet prescribed, and we're going to reassess. And if the cat is not improving or hasn't improved, we're going to have to call the vet or potentially take the cat back to be able to continue on with the med. I think that pretty well summarizes the documentation, what's needed. Obviously, you know why that's important, so we can monitor.
Notes page like where the cleaners make notes and.
Yep, I'll show you that. So this is the other page. It's a continuation. It starts on this first page that we have when they come in. But again, so by design here, you'd put the date and then the observation. So the cleaning staff during the day that's going through each of the cages, they're going to note the observations. Kitty sneezed, diarrhea, dehydrated, lethargic, or eating, drinking, peeing a lot, whatever their observation is. And then we have the opportunity to say, okay, that's what they saw. They've seen it a couple of days now. This is what we need to do. And then you would do it, whatever it is, fluids, Panicure, whatever it may be. Yeah, and I like this design. I think it makes good logical sense. Yep. And then you just continue on, grab a new page if you need to keep it going. These ones, again, are our internal records. So it's, feel free to be as descriptive or as long, lengthy, wordy as you want. That's fine.